Let's pick up where we left off. I know. It's always like this. The first couple warm spring days, everyone's like, woohoo! Yay! No, they're not sitting in the mud in the quad.
No, they are. They have a blanket.
Well, are you okay over there? All right. Let's settle down. Let's go. Okay? So, let's pick up where we left off. We're talking about blood flow on Monday. All right? And so flow of blood is really how well, right, blood moves through the vessel. And part of that, all right, as blood flows through the vessel, and we can change the way blood flows depending upon constriction or vasodilation, vasoconstriction, you can increase or decrease resistance. Okay? And resistance is the friction by which blood moves through, right? The friction that blood experiences as it goes through the vessel. Okay? So it's due to contact between the blood and the vessel wall. Okay? Friction opposes the resistance. Resistance is opposition. Okay? All right, so resistance is opposition to blood flow. Okay? And what we're really talking about in this case is peripheral resistance. We're going to be talking about this quite often today. Peripheral resistance. All right? Peripheral because it's outside of the heart. The peripheral blood vessels offer your resistance. And there are three major factors that play into resistance. Okay? It's affected by viscosity of the blood, okay, vessel length, and lumen size. Let's talk about viscosity first. Okay? When we talked about viscosity earlier, we talked about how the blood the viscosity of blood is altered in response to what? When did we talk about viscosity previously, Casey? Plasma proteins and what else? We had talked about something previously, and we mentioned about viscosity. We talked about blood viscosity when we talked about what? What about the blood? Emma? The amount of red blood cells. Really, we're talking about the amount of formed elements. You have more red blood cells. They're the most numerous, so they're going to be the biggest factor in determining blood viscosity. All right? What is viscosity? So we understand.
Thickness of the blood.
Right? Well, things in the blood. What?
Thickness of the blood.
Thickness of the blood, right? Or viscosity is not just about blood, but it's also about any fluid, right? So if I dumped, 2 cups of sugar in your water bottle, now there's going to be more stuff in it, right? And it's actually going to be thicker than water, okay? The more stuff that's in and floating around in the fluid or in the liquid, the thicker it is, the higher the viscosity, okay? So you can compare the viscosity of vegetable oil versus water. One is thicker than the other, okay? And the thickness of blood depends upon the number of formed elements, okay? So it increases with what? More formed elements, higher viscosity, right? So it increases with the number of formed elements. It decreases with less formed elements, right? So low viscosity would be like someone who's anemic or has anemia, right? That's a low. What is anemia? Remember what anemia is?
Low blood pressure.
Low what? Lower than normal red blood cells. Okay? Okay? And viscosity can increase with things like blood doping and taking hormones such as erythropoietin. It could also decrease. We're all warm in here today, right? We want to go out. John wants to go out and get a water. Okay, he's sweating profusely over there. This continues. He sits in the sauna for an hour. What happens to the amount of water he has in his body? It decreases. What happens to his blood volume? It decreases. What happens to the percentage of red blood cells in his blood volume? If blood volume goes down, right?
Red blood cells have to increase.
Because blood volume goes down because of loss of water, right? That leads to an increase in red blood cells. That then leads to increased viscosity. Okay? But what happens if you lose red blood cells because you're hemorrhaging? And then the doctor gives you IV fluids to help increase your blood volume. You're still losing red blood cells, right? What happens to viscosity? It decreases, right? It decreases. So it depends. So viscosity is a function of the formed elements that are present in the blood itself. Okay? So that's viscosity. What about vessel length? Do your vessels change in length from day to day? Quickly? In length. Not unless you have a severe trauma where you're cutting off an appendage. Okay? No, they don't change in length very quickly. But they do grow and regress, that we talked about on Monday, angiogenesis and regression in response to increased body size. So you have increased body size, increased muscle, blood vessel length. What does that do to resistance? What do you think it does? Okay, so what's the relation? The question then is, what's the relationship between vessel length and resistance? Amanda.
More length equals more like resistance.
Right, the longer the vessel, the more force you have to put behind getting the fluid through that vessel, right, all the way through. So the longer the vessel, the higher the resistance. Okay, and it also increases friction, because vessel length, friction occurs along the length of the vessel, along the vessel wall, right here. So as blood is passing through, right, in the middle they have what's called laminar flow. There's very little friction in the middle. But the blood cells that are coming along the vessel wall, they are bumping into onto the sides. They're getting some turbulence, right? The friction is greatest at the vessel wall and least in the middle, right? Because this is still, there's solid material within this fluid. So the longer the vessel, the higher the resistance. Okay? Now, what about lumen size? What does lumen size mean? Where's the lumen of a vessel? It's the diameter, right? So you have your lumen is that open area right here, okay, right there, where the blood can flow through. How does that relate to resistance? I think I used this analogy before. I hook up a hose. A fire hydrant is really a pump, right? It's an opening to a water source, and you hook up the fire engine pump to pump water out to get to somewhere. Now on that pump, there's like a 4-inch hose, 4-inch diameter hose. Now I pump water through, and water goes out of the end of the hose. I have to have so much pressure and so much force to push the water through the hose, right? Now, so I have a 4-inch hose hooked up, and I'm, putting out a fire, or so much water is going through. Maybe it's going out slowly. But now I hook up a garden hose, which has a 1-inch or less than 1-inch diameter. What happens to the resistance? It goes way up. What happens to the pressure inside the vessel? It goes way up. Okay? And I haven't changed anything in terms of how much water or how much liquid is being pumped through the vessel. I've just changed the diameter of the vessel itself. change the diameter, I increase resistance, I increase pressure. All right? So this is one of the changing in lumen size is one of the biggest factors in maintaining and mean arterial pressure or overall blood pressure. Okay? Your blood vessels will constrict and dilate, right, in response to a number of factors we're going to talk about in a minute. Okay? That will help regulate blood pressure. So what's that relationship look like? Okay? Relationship between blood flow, pressure gradients, and resistance. Okay? So we've talked about pressure, how much, which is really a function of how much blood is being pumped out of the heart into a closed system. Okay? So we're always putting more fluid in, it has to come back. So there's a total amount of blood flow. That's a measurement of how much blood's coming out of the heart, right? So total blood flow, amount of blood moving through the system per unit time. So you think about stroke volume or cardiac output. What is cardiac output? Cardiac output is equal to heart rate times stroke volume, right? So stroke volume is in mils, and this is unit heart rate is in beats per minute. So this is beats per mil, so you can cross out beats. And this ends up, cardiac output ends up being mils per minute. Last time I checked, that's the amount of blood moving through the system, the heart, per unit time. So total blood flow is directly related to cardiac output. Okay? All right? And then so the flow, or how well the liquid moves through the system, is proportional to the pressure gradient divided by the resistance. So flow, change in pressure divided by the resistance. Systemic pressure gradient is your change in P. What do we know that is? What do we talk about this? What's your pressure gradient? What's the pressure in the aorta versus the pressure in the vena cava? That's your pressure gradient, right? And we talked about how that's been maintained through systolic and diastolic contractions, or systolic contractions. And then you have your resistance. As resistance increases, blood flow decreases, okay? And your resistance can be increased by increasing viscosity, increasing vessel length, or decreasing vessel diameter. So if resistance can be increased by doing these things, how can you decrease resistance? Give me an example of what you could do to decrease resistance. I just gave you 3 examples of how you're going to increase resistance. How do you decrease resistance? What's the biggest one you can do? Amanda?
Increase the diameter.
Increase the diameter, right? You change the lumen size, right? So if you increase diameter, you go from this size vessel to this size vessel. You lower pressure, you decrease resistance, you're giving a larger area for the blood to flow through, less friction, less resistance. Okay? So there's a proportional relationship. All right? And I put in cardiac output here because we're going to talk about how your body controls this relationship. Okay? How does your body control that relationship? There's a number of ways. Okay? So what you're looking at here in this picture, total blood flow related to cardiac output. All right? Pressure gradient, that's established by the heart through its systolic contractions, right? And then the resistance experienced by blood as it moves through the vessels. So if you have that resistance, what ends up happening? Okay? So let's look over here. Cardiac factors that increase blood flow. I already told you blood flow is a function of cardiac output. So what factors increase cardiac output? This is all really gonna build on a lot of the stuff we've already covered, okay? And we're gonna kind of put it together today. in terms of blood pressure. But we talked about a number of factors that control cardiac output. We talked about increasing heart rate, increasing stroke volume. Whatever, if you do those things, if whatever they might be, sympathetic nervous system input, exercise, whatever, they increase heart rate, it's going to lead to increase in cardiac output, and that's going to increase. That's going to lead to an increase in blood flow. Okay. A vasodilation. Okay. Vasodilation will open up this and will open up a blood vessel lumen and allow blood to flow free more easily with less friction, and it would then reduce the pressure gradient between them. All right, and then factors that decrease total blood flow, vasoconstriction, right? Any decrease in cardiac output, all right, and how this relates to pressure, all right, inversely. So this relationship, cardiac output, pressure, resistance, we're gonna there's a direct proportional relationship between those. All right. So systemic blood pressure and resistance. There are clinical conditions that lead to sustained increased resistance and elevate blood pressure. Diet, obesity, atherosclerosis. Right? What do we know about obesity? What does it do? Increase in body size. What does it do to vessel length? You have increased vessel length. That leads to increased resistance, right? And that actually leads to an increase in systemic blood pressure. Atherosclerosis. We went through the structure of what happens. I put up a a picture of an atherosclerotic artery. What happened to the lumen of an atherosclerotic artery? Was it big or small? It was smaller. Smaller lumen means increased what? All together now. Okay, so this makes the heart work harder to overcome a higher resistance, right? You have higher resistance in the periphery. The blood still needs to put out the same amount of volume out into the system, and your muscles still need, your body tissues still need the same nutrients and metabolic requirements. Okay, maybe even more. So the heart has to work harder. And that's one of the problems with blood pressure. Okay. Now your book includes a couple different clinical views, and one that's important to understand is circulatory shock. Okay, and there's a couple different categories of circulatory shock. All right, so shock. You go into shock, that is a response to insufficient blood flow through an area or through the brain to perfuse tissues. By perfusion, we're meaning that blood is being delivered to the tissue for adequate exchange. Okay? If not enough blood goes through there, not enough exchange happens, not enough oxygen is delivered, things go crazy. Okay? This can be due to an impaired heart, so you could have congestive heart failure. It could be due to a low venous return. And this is what we call hypovolemic shock. Okay? Hypovolemic shock. So, John Quinnipiac student, decides, oh yeah, I'm real smart and I'm going to have fun and go drinking and then drive. He ends up in a car accident or texting and driving. We've all done it. Don't lie. Okay? And he ends up in a car accident, and in that motor vehicle accident, he ends up with a large trauma. And he's bleeding. Okay? What happens to blood volume? So blood volume goes down. What happens to venous return to the heart? So, right, venous return goes down. What happens to his heart rate in response to that? His heart rate goes up, right? Because we want to keep, heart rate goes way up. We want to keep cardiac output at a certain level. What happens to blood pressure, though? Right, blood pressure goes way down, right? because blood pressure is equal to cardiac output times peripheral resistance. And because he's bleeding, what's happening to peripheral resistance? It's not as high. There's no stoppage of flow here. It's flowing freely out of his body. That's a problem. Okay? So, as doctors or veterinarians and nurses, you'll understand that one of the things that I learned when I was in first semester of veterinary school before I left was all bleeding stops. Okay? All bleeding stops. Okay? And importantly, you need to stop it before other problems occur. Okay? Especially in this case. Hypovolemic shock. All right? So that's from hemorrhage. You can have it from dehydration, allergic reaction, obstructed veins, all right, or venous pooling from prolonged immobility, extensive vasodilation from bacterial toxins, etc. All right? Other important clinical aspects of blood pressure. Cerebral edema, right? So excessive interstitial fluid. We're going to talk about the lymphatic system probably starting on Monday. And the role of the lymphatic system is to pick up excess fluid that is pushed out of the vessels by the tissues. Okay? So that when you get back, when blood comes back to the right atrium, it's going to mix back with that excess fluid that's been picked up so that you're not a net loss of volume every time blood runs through the system. Okay? Because if that was the case, our heart rate would go skyrocketing and we would end up losing volume of blood every time. And we'd be drinking water like crazy. Okay? So if you have a higher pressure, it pushes more fluid out, but in the head and in the cerebrum, there are no lymphatic vessels. So in the cerebrum, you can't pick up excess fluid. So if you have a high mean arterial pressure, right, 160 milligrams over mercury, 160 milligrams of mercury, mean arterial pressure. Mean arterial pressure is equal to what? Is equal to diastolic pressure plus 1/3 of the pulse pressure, right? And the pulse pressure is the difference between the top number and the bottom number. Right? And diastolic pressure is the bottom number. If mean arterial pressure is 160, that's like your blood pressure is like 200 over 100, 120. Okay? It's pretty high. All right? So this increases filtration and the loss of fluid, the movement of fluid out of the blood into the brain, and causes excess fluid in the brain. In infants, this is called hydrocephalus. You get water in the brain. What happens in adults in this case? What do you end up with? You have excess fluid in the brain, but what happens? Your skull is not getting any bigger. Increased pressure on the brain. You end up with headaches. Prolonged headaches could cause brain damage and eventually could cause death if not dealt with. All right? So hopefully this sets up the stage that there's a relationship between blood pressure, cardiac output, and blood flow. And by blood flow, we're really concerned with the peripheral resistance that is going to prevent blood from flowing freely. Okay? So your body works to keep blood pressure in a proper range, right? We know that normal is what? Textbook normal is what? 120 over 80, systolic over diastolic. You don't want it to be so high because eventually that will cause problems on your blood vessels. Your blood vessels, every systolic ventricular contraction, they stretch. And if you have a high pressure, that causes them to stretch, and then they stretch further. Eventually that causes problems. All right? And in some cases, you could end up with a little ballooning of that blood vessel, what we know is called what? An aneurysm, so the blood vessel kind of balloons like this because it's stretched too much, right? An aneurysm. And your blood pressure depends upon cardiac output, resistance, and blood volume. Okay? And I think I've kind of set that up. Your body collectively integrates this to regulate these three things in order to help regulate blood pressure. So you have nervous and endocrine systems will coordinate and work to maintain this balance, to maintain a certain blood pressure, because blood pressure is equal to cardiac output times peripheral resistance. Okay? And then cardiac output is equal to heart rate times stroke volume. And the stroke volume is where we can influence stroke volume by influencing and changing blood volume. We can influence heart rate by increasing or decreasing heart rate, sympathetic nervous system, parasympathetic nervous system. We can vasoconstrict or vasodilate blood vessels that will help change peripheral resistance, all targeted at maintaining a consistent blood pressure. Okay? So let's go how this happens. This little diagram right here really puts everything into perspective. Okay? Within the brain, within the medulla, you have cardiac centers. Okay? You have nuclei, right? Collections of cells, of cell bodies within the medulla that will help regulate heart rate. Okay? You have a vasomotor center and a cardiac center. Okay? The cardiovascular center has, so you have your cardiovascular center within the medulla, right here, all right? And that within it has two distinct parts, a vasomotor center and a cardiac center. What do you think the cardiac center controls? Heart rate, right? So you have within the cardiac center, you have a cardio-acceleratory center and a cardio-inhibitory center. What's the cardio-acceleratory center going to do? Increase heart rate, which leads to what? Increase cardiac output. Okay? Now the cardio-inhibitory center is going to decrease heart rate, which leads to decreased cardiac output. All right? Good. All right, so this was allowed the neural inputs that we're going to talk about. What's the relative speed at which they will respond to changes in pressure? Fast or slow? It's a fast. Okay? So you're all sitting down right now. You did this in lab, and you stand up quickly. Has any of you ever were laying down and stood up quickly and kind of like, whoa, a little lightheaded? What is that from? That's a quick,
There's a drop in blood pressure.
There's a drop in blood pressure. Some people have it where they actually faint, okay? But you have a drop in blood pressure, all right? So your cardiac centers and your vasomotor centers, the quick responses here will help regulate cardiac output, all right? The vasomotor center, what do you think it does? Vaso refers to what? Vessels. Okay? So vessels. And what are we going to move in vessels? What can we move in the vessels? What part of the vessels can contract and move? Smooth muscle, right? And smooth muscle helps control what? The diameter of the vessel, right? The lumen size. So the vasomotor center is going to help control vasoconstriction, vasodilation, which changes what? In terms of regulating blood pressure, what does the vasomotor center help control? Again, remember that what? What is blood pressure? Cardiac output times peripheral resistance. Oh, let's move that down. right? So the vasomotor center is going to work on this. It's going to alter the peripheral resistance by influencing vasoconstriction or vasodilation. Okay? And it works through epinephrine, norepinephrine, sympathetic pathways, right? If there's an increase in sympathetic pathway, that'll cause vasoconstriction, and then it decreases activity of the sympathetic pathway, and that causes vasodilation. Okay? Questions on that? No? Good. So, what else? Well, there's a bunch of other neural pathways you see here. Okay? So you see the vagus nerve actually goes in and attaches this. So from the vasomotor center through here down to blood vessels. And this actually says this right here, alpha 1 or beta 2. Okay? So blood vessels with alpha 1 constrict. Right? Vessels to the skin, abdominal vessels, right? And then vessels to beta 2. The same sympathetic pathway. That's a sympathetic nerve pathway, ganglion that goes out. So the same one is going to alter blood flow. It's going to cause certain capillaries to constrict and other capillaries to dilate. Okay? What does that do to blood flow? Does it help regulate it? Yeah, where is it putting it to? So this is a sympathetic nervous system, which means what it does to your heart. It increases, right? This is an exercise, excitement, embarrassment, emergency type pathway. Okay? So we're going to shunt blood from the skin and the abdominal organs, because we're not resting and digesting. We need to put blood and nutrients to the skeletal organs to fight or flight. Right, for muscle, for exercise, and to the coronary vessels so that the heart can go faster, right, and deliver that oxygen to the heart. Right, so think about how the vasomotor center is going to do that. Okay? Regulation of cardiac output, your cardio-acceleratory inhibitory centers through the vagus nerve or the glossopharyngeal nerve will help regulate. They will terminate on the SA and the AV node, which does what? What does the SA node do? It's your pacemaker. Helps regulate what? Heart rate, right? So if I get more or I get less parasympathetic nervous input, the heart rate's going to go up, right? So this will help control the heart rate as well. Okay? So that's that's some of the neural parts of this. Now there's over here in this yellow box to the right, there's receptors. All right? And these inputs are important in helping regulate blood pressure as well. Because pressure is so important, there are receptors in your body that will recognize changes in pressure. They are called baroreceptors. Okay? And where in the vessels that you've talked about and you've learned is pressure really, really important? Where have I talked about it multiple times as being the highest pressure vessel in the body? The aorta. Okay? So it makes sense, think about this intuitively, it makes sense to check, to have a quality control point as blood's coming out of the heart in the aorta to determine the right pressure that's there. So baroreceptors are in the aortic arch. Baro is pressure, barometric pressure. Those are pressure receptors in the aortic arch that will determine if pressure is too low. They will send a signal to the cardio-inhibitory center, cardio-acceleratory center to either speed up or slow down heart rate. Okay? So they'll check for pressure. Another place for that is the carotid sinus. Where does the carotid artery go? Where does it go? To where? It supplies blood to the... Is the brain pretty important? Absolutely. So, do we want to make sure that does the body want to make sure that blood is going to the brain? Yes. Okay? So, those receptors are within the carotid sinus to make sure the pressure is high enough so that blood is getting to the brain adequately as well. Okay? So, those pressure sensors are in places where they are of utmost importance. All right? And that will send inputs back to the cardio, acceleratory, inhibitory centers in order to adjust heart rate. Okay? There's also some baroreceptors within the right atrium. What is that? What do you think that does? Where is blood coming from when it enters the right atrium? It's from the vena cava, right? From the inferior and superior vena cava, and also from the coronary sinus. Okay? Do you remember what we talked about in terms of regulating heart rate or regulating cardiac output? What was an important amount of blood that was coming back to the right atrium? Remember what that was called? There were 3 different things that we talked about. One was the amount of blood that's left in the heart after contraction, and one was the amount of blood that goes into the heart prior to contraction. Remember what that's called? Cardiac physiology. We talked about afterload and preload. And if we increase preload, what did it do?
Increase the stretch.
It increased the stretch of the heart. That increases stroke volume. Okay? So, a baroreceptor within the right atrium recognizes pressure, recognizes stretch of the heart, and will help it contract harder to push up as much blood out as possible. Okay? Will increase stroke volume, and that is in response to preload. More blood comes back to the heart, you get a stretch, right? And it will help slow down heart rate or increase heart rate, increase the strength of heart rate, of the heart. Okay? So those are baroreceptors. Okay? Sympathetic and parasympathetic nervous system. And then we have these other things. Chemoreceptors. What do chemoreceptors look out for? Chemicals. They're going to look out for things like pH, presence of hydrogen ions. They're going to look out for things like carbon dioxide, oxygen. All right? And if you don't have enough, what's going to happen? If you have a low pH or low carbon dioxide, these receptors are going to recognize that and stimulate the appropriate responses. Okay? All of this is neural in origin. Okay? And these chemoreceptors will also respond and recruit the endocrine system to help regulate blood pressure. Okay? You also have some higher brain centers. The hypothalamus can increase cardiac output and resistance, right? Increase body temperature, the fight or flight response. And the limbic system, which is important for emotions, can alter blood pressure in response to certain memories and emotional states. Okay? Questions? All right, we'll stop there for today. Finish out your quiz.